Abnormal veins can be treated on almost any area of the body. Just about every vein that we see through our skin, whether they be on the legs or on the face, sometimes on the chest, can be treated using various methods. Certainly the most common abnormal veins are what we call spider veins, which can occur on the legs most often. And the best way, without question, to treat spider veins is using sclerotherapy, and that is injecting a chemical into the vein, causing the vein to scar inside, and then the vein is reabsorbed and it goes away. It is the gold standard for the treatment of typical spider veins. Varicose veins can also be treated using sclerotherapy. No matter how big a vein is, it can be sclerosed or caused to scar inside, with the result of it being absorbed. Veins on the face are often problematic, abnormal veins. Some people get veins that you see in the temple area or underneath the eye, and they're usually tributaries of a larger vein that we like to leave alone, but we can certainly get the tributaries to go when they're big enough using sclerotherapy. That's something not many people in the country do. I happen to have been doing it now for years, because once you learn sclerotherapy well, you feel confident treating those abnormal veins on the face. The tinier veins, called telangiectasias, usually occur on the cheeks, about the nose, sometimes on the chin, and they're best treated using a laser. A laser has no effect on spider veins on the legs. That's been proven over and over and over, and yet some people still use lasers on spider veins of the legs. It is a waste of time and money. It hurts more than injecting them, and it doesn't work. But on the face, it does work. And there's a number of different lasers that can treat the tiny broken blood vessels, we call them, or broken capillaries that occur on the face, using one of several different lasers that cause the vein to heat up and be killed, if you will, without hurting the surface of the skin. And all these different modalities we have at the Vein Center in Cosmed, and have been employing them for over 25 years. Sometimes a vein needs to actually be taken out, if you will, operated on. If it's a big enough vein, usually in the leg, that's too big to be injected, to remove one branch of a vein is relatively simple under local anesthesia, but it will leave a scar and it will leave some discomfort. Another vein that we treat at the Vein Center in Cosmed, which I believe relatively few people do in the country, that is the treatment of large, ropey, ugly, old-looking hand veins. Most women who develop these veins can't stand the looks of them because it does make their hands look old. They're usually normal veins, but especially in women, as time goes on, our skin gets a little thinner and you can see through the skin better, and the veins definitely do make the hands look older. And most people say that you can tell someone's age by the looks of their hands. So they can be injected the same way a varicose vein can, using a little bit different solution, different concentrations. It may take several times, but we get great results in getting rid of those ugly veins on the backs of the hands, which we don't need. Even though people think we do, we can live a normal life without any of them.